Hey y'all, I'm Ashley Curtis. I'm from West Coast University, and I live in Dallas, and so that's the campus I go to. I am in my sixth term of nursing, and I'm currently in my pediatrics rotation. I did my research on C. diff, so that's also called Clostridium difficile. That's the proper name for it. C. diff is the short name. C. diff is an anaerobic spore-forming bacteria. It's a bacillus. C. diff is also really hard to kill. It um, C. diff forms from long-term antibiotic use, and so the gut is their homeostasis has been disturbed. Therefore, you're able to form spores, form Clostridium difficile, which causes diarrhea, very severe diarrhea and dehydration, and it causes a lot of death in patients. So, with my research, it is transferred from one patient's room to the next, usually by healthcare professionals who do not perform proper hand hygiene or follow proper precautions such as contact or even standard. So with C. diff, it requires contact precautions. So with contact precautions, you have to use PPE equipment, which is personal protective equipment. And I'm sorry, you can barely see me. Okay, it's also personal protective equipment, so that's gowns, gloves. If you need to use a mask, go ahead and use a mask. They ask that if you're going to use a mask, go ahead and use one with a shield to prevent from splashing and splashing into your face. And you can spread that so easily from patient to patient because we're so used to using hand gels, gelling in and gelling out. Well, that's not going to work. We have to use soap and water to wash our hands. Before and after the patient, go ahead and wash them for 30 seconds, scrub underneath the nails to prevent from transferring from one patient to the other. And as healthcare professionals, we do need to know how to properly put on the PPE and take it off without contaminating each other. Just like we learned sterile technique, there's also contact precaution technique with putting on the gown. Moving on with that, do not use your hand gels and make sure you provide patient teaching and for their families because they're going to come visit. So with this disease, we don't want to touch anything in their environment or at least bring it to other people's environments. That's how people spread C. diff from one room to another. C. diff is caused by long-term antibiotic use, like I said earlier. They're usually beta-lactam drugs, also known as ceftriaxone. And ceftriaxone is also used by a lot of patients to treat infections that they were first admitted to the hospital. And then they end up with this hospital-acquired infection, which is C. diff, and insurance is going to pay for it, and I'm sure you don't want to pay for it either. So moving on to the real part of my research, the article I was interested was by Synthetic Biologics, which is the company that formed this drug. It's called Syn-4, SYN-004. I'm just not going to say all that, so 004. But they haven't actually named this drug yet. And with this drug, it's supposed to protect the gut while you're on antibiotic therapy because the homeostasis of your intestines, of your gut, and of everything, it becomes disturbed, and this drug is supposed to help coat it and allow you to use your antibiotics without forming C. diff or Clostridium difficile. Let's see here. With this long-term antibiotic, just know that it disturbs the pH. These clinical trials were started with smaller groups and started with a size of 10. And then later on through the phases, there are 4 phases that they've used so far, they started increasing as they saw results. And they wanted to first test on a small group of people. With Syn-4, it's an oral prophylactic drug. The major techniques used in the study include using small sample size for their experiment, so that's a good idea. I thought it was a great idea to use 10. They're randomized, and they were given the initial dose to evaluate the GI antibiotic degrading effects and the safety of this drug, Syn-4. According to Synthetic Biologics on their page, the clinical trial was intended to evaluate the effectiveness of SYN-4 to prevent CDI in patients hospitalized for lower respiratory tract infections and receiving IV ceftriaxone and other beta-lactam antibiotics. With the results, they show that there were no effects on blood levels of the antibiotic or primary diagnosis cure rates. So it's not going to cure the primary diagnosis, and it shouldn't change the blood levels in patients who are receiving this SYN-4 along with their other antibiotic therapy. With SYN-4, it just showed so far that it was able to prevent incidences of C. diff in patients receiving long-term antibiotic use. The strength of this article was that the company was able to, I believe they were able to describe this drug in great detail. They provided videos and instructions and how the drug was made, what ingredients were in it, why the ingredients were used in it, and I thought that was wonderful. It made me feel confident as a consumer to buy this drug or to take part of this study or allow the doctor to prescribe me this drug while I was in antibiotic therapy for my infection. So I believe the strength was that they were able to describe the drug very well, and they were able to, I believe, cover every corner. The thing that I've noticed that wasn't on this study is that after phase 2, with 10 people, they didn't say how many people they were increasing in using. Also, I don't know anything about these patients that they're using, how long they've been on antibiotic therapy. So if they've been on for like 5 hours, then no, they haven't given enough time to disturb the gut and actually form C. diff. So I don't know how long these patients have been on antibiotic therapy. I need to know their background. I need to know why they're in there, what kind of infection do they have, what drug have they been on, and I don't know any of that. So it was hard to rely on this article because it was giving me minimal information about these patients that they were using and how many patients they were using after their second phase. Also, the results weren't clear. It didn't say how many people were okay. It just said that the patients have not formed C. diff at the end of their trial. I lost a little confidence in that one. With this drug, unfortunately, due to the needs of antibiotics to help cure infections in patients, C. diff is always going to be hard to prevent from happening. So I feel like this medication would be a game changer for all of us. C. diff occurs so much in my workplace where I work in the ICU, and even at nursing homes where I used to work, and older patients. This drug would help with that a lot, even affecting our healthcare workers. I believe that we'll be able to eradicate that altogether if this drug was properly studied and implemented and put into our markets. I personally did not know that there was a way to prevent C. diff from developing in our guts. I thought that we would just have to take a chance when receiving antibiotic therapy. If this drug could be administered simultaneously to every patient, C. diff would be eradicated. Hand hygiene is not optional when it comes to patient care. As a nurse, it's our responsibility to maintain and enhance the health of our patients. C. diff has shown to worsen the health of our patients and to worsen our health altogether, leading to death because of dehydration. We're losing all that water from defecation, and our stools are very loose, and patients just end up getting sick. Let's see. Just remember that gel hand sanitizers are ineffective when it comes to this infection. So always use soap and water. Patient teaching needs to be initiated at all times and reinstated throughout their stay. So that's about all I have with C. diff. Thanks for watching and listening. It's getting dark. I'm going inside.